The terms are very simple, Hina, Mithya, Adi, but it is very deep. It is not limited to our physical structures, but also to the minds, mental status. For example, if a person is running a lot, the whole day is running, that is Adi Yoga of that leg. The leg or that lower limb is not considered to run the 24 hours. So, that becomes another yoga. Or suppose a person is not at all walking, he is sitting quiet in the bed or in a chair the whole day, that is Hina yoga. There should be some movements, that is the proposed karma of that organ. Here there is deficiency in that particular karma. Like that we can take any organ, and suppose you read concerning our eyes, he is not at all visualizing, always sleeping, that is Hina yoga of his eyes. That also will bring some defect in his karma, that is karmas are not performed. Or on the other way, he is continuously watching something or some illuminated version, just like mobile works or screen works and watching TV like that, that is Adi yoga of the eye, that particular indriya. Indriya means sense organ. So, whatever organ we take, we can see this difference. The Mithya yoga means, if it is, he is not using his organs in normal way, either in lying position or in sleeping level, like that, if he is using that organ in his abnormal way, that is Mithya yoga. All these three is capable of bringing its own manifestations. That manifestations are developed as signs and symptoms in that organ, and that is known as disease. So, any organ will have this, we can come to this same points, the leg or nose or ear or eye or mouth or tongue, whatever organ is not doing its karmas in perfect way or in a deficient way, then it is Hina yoga. Or it is doing its karmas in more than its own scientific way, it is known as Adi yoga, and not in the normal or in the scientific way, that is Mithya yoga. So, we have to see in which way that is developing this manifestation or signs and symptoms. We have to identify how this disease is happening or how these signs and symptoms are happened, either by this Hina yoga or Adi yoga or Mithya yoga. This is more important nowadays in the mental status. You may be overstressed or overthinking, then that like that we have to consider also our other activities, just like sleep or eating or taking baths. In every aspect of our life, we have to take these three things, whether it is in a scientific form, that is normal way. If it is any change in that, that is Mithya yoga. Or suppose a man is not taking enough food, that also is responsible for some manifestations as disease. Or if he is thinking a lot and stressed a lot, that will bring out some manifestations as signs and symptoms and termed as disease. So, in short, we have to consider all aspects of our life, from very beginning to the up to until the last, whatever aspects, physiological or physical or mental or social or all aspects we have to, or professional, all aspects we have to consider, whether it is deficient or over. That is the underlying theory of this, and this is bringing out its own defect in its karmas, and we have to identify, to analyze the signs and symptoms on the basis of the defect in the karmas. Now, let us consider the Mithya yoga, that is anything done, any activity or any action which is not in a scientific way, that is known as Mithya yoga. We can, for example, eating is okay, quantity is same, but the combination or the proportion may not be correct, or the preparation may not be correct, overcooked, or in the timings, scheduled timings. These are all there are all scientific methods for the each things, but when we are going beyond that scientific methods or scientific levels, that is known as Mithya Yoga. If you are coming to, for example, one sense organ which is very important, that is our eyes. If he is always seeing something or watching TV in lying position, then that is Mithya Yoga. Or watching this mobile works in dark room only, that is Mithya Yoga. Or looking at the sun with the naked eye in the unscientific way, that is also Mithya Yoga. Like that, which is unscientific in its action, that is known as Mithya Yoga. This can be considered in any part of our body. Hearing and too loud things, that is Adi Yoga, and hearing in sleeping time, making noise in the sleeping time, or too much listening too much small amplitude voices, or mixed combination of different volumes of different types of sounds together. These are all Mithya Yoga. Like that, if we think we can understand what is Mithya Yoga, what is Hina Yoga and Vadi Yoga, from our daily activities we can identify that.